I, Raghvendra Nigam, welcome you once again in our YouTube channel RTeamCreations Health and Awareness. Today we have come up with a very valuable information on a very common disease called kidney stone. To understand the disease, we pan towards the renowned practitioner, teacher and our expert, Dr. Madhu Sudan Agrawal from Agra.
I am Dr. Madhu Sudan Agrawal. I am a urologist practicing in Agra. I have worked in the medical college for almost 25 years. I am the past president of Urology Society of India and currently the president of the SARC Association of Urological Surgeons. And one of the common problems that we face in our country is the stone disease. Stone disease is becoming increasingly common in our population for multiple reasons, and one of which is poor intake of fluid. Second thing is the lifestyle changes, high intake of protein and maybe junk food, and most importantly the prevalent use of tobacco and pan masala especially. So what we have seen in the years, in the last 2-3 decades, is a rising trend of stone disease in our population. And stone disease can be very troublesome to the patient, and somebody who has experienced it would know the severity of pain which occurs in whenever the stone pain strikes.
It can treatable or surgery is the only solution?
Now in past it used to be operation always, but now we have technology which allows stones to be removed painlessly, quickly and with minimum injury to the body, minimum risk and very quick recovery. And this has become possible with the use of lasers, the keyhole surgery, what is called the telescopic or endoscopic surgery, and all the new technology which has come in. See, traditionally it is believed that stones will come out with some local or some homeopathic or Ayurvedic treatment or jadi booty. However, the truth is that small stones come out on their own. Small means stones up to 4 to 5 millimeters in size. But if it's a large stone, then it requires to be removed. And the reason is that if there is a stone inside, it will cause pain, it can cause bleeding, it can cause infection, and if left alone, it will damage the kidney and you end up in complete kidney loss. So removal of a obstructing stone which is big and which will not come out with medicines is required.
Doctor, one can lead his normal life after treatment or a surgery?
Yes, people can go back to normal routine, in fact regular work within a few days, and except that you have to remember the precautions as I mentioned, you can resume normal life.
Even after a treatment, how much chance are there for a reoccurring?
Yes, it is also important to remember that once somebody forms a stone, there is always a risk of stone happening again, either in the same kidney or in the other kidney or in both kidneys. So one has to take adequate precautions to make sure that stones don't start forming again. And this includes high intake of fluids, because dehydration is the most important cause of high stone disease, especially in our country when the weather is hot and sometimes humid, and this results in loss of water from the body. Second thing is dietary restrictions, and most important things like pan masala and tobacco have to be completely eliminated. In addition, there are certain substances which produce stone and they have to be avoided. But it's also important to remember that the traditional precautions which are generally advised
Is it true that we have to remove or avoid some fruits, vegetable or a milk in our regular diet?
Like tomato are actually quite harmless and they don't form stones. So that's one myth. Another myth is that any vegetable or fruit with seeds will cause stone, which is completely untrue. The seeds never reach the kidneys, so they are all digested or they stay in the intestinal tract. So you don't have to follow what is generally said in public, but you have to follow the doctor's advice. And when a stone is removed, we always get it tested to know what is the content, and accordingly precautions should be taken. Similarly, it is said that you stop taking milk and milk products if you have a stone, which is again untrue. If you stop taking milk, you cause more harm to your own body. So first of all, if somebody gets a stone or somebody gets a pain, he or she should consult the physician, your family physician, and the family physician or the doctor will identify whether this pain looks like a stone pain. And if this is so, then you need some tests including ultrasound, X-ray, and nowadays increasingly we are using CT scan to identify the stone. And once we identify the size and the numbers and the location of the stone, we decide whether this can be treated with medicines or this requires to be removed. And if it is causing damage, as I said earlier, then it requires to be removed. And with the new technology, and this includes procedures which are in medical language called ureteroscopy, like URS, or PCNL, percutaneous removal, or ESWL, which is called lithotripsy in general terms. There is a newer technology called RARS, and all these are basically endoscopic procedures where without a cut or a stitch, the stone is removed through normal channels, normal passage, and sometimes through a very tiny 2 millimeter telescope entry, and the stone is crushed, dusted into small particles with laser and removed completely. So the patient becomes stone free, and most of these procedures can be done with a very short hospital stay, less than a day, and it's quite safe. There is very little risk. Unlike the past, patient does not have to remain in the hospital for a long time, and most people can go back to work within the next few days.
So we will conclude our talk here with the message of our expert.
So my advice to our audience, people who are listening to this talk, would be to live healthy, eat healthy, drink a lot of water, and consult your physician at the first point as soon as it is required, rather than going for unconfirmed, unproven treatments, which most of the times don't work. And you can be assured that if you ever develop a stone, in good hands, the procedures for stone removal are today very safe, very effective, and very much free from trouble. In fact, the more pain you get in one episode of stone colic, the removal procedure takes even less time and causes less bother. Thank you.
Friends, if you like our efforts and information, please share this video link with your friends and family so that maybe they can live their happy and healthy life. Thank you.